How does gout joint fluid analysis confirm diagnosis? Imagine you're trying to figure out what's causing sudden, intense joint pain. One of the most reliable ways doctors confirm gout is through joint fluid analysis. This process involves taking a tiny sample of fluid from the swollen joint using a needle. This is called joint aspiration. The doctor carefully inserts the needle into the joint space, usually where the pain is worst, and draws out some synovial fluid. This fluid is then examined under a microscope. Using polarized light microscopy, the lab looks for specific crystals called monosodium urate crystals. These crystals are needle-shaped and show a characteristic negative birefringence, meaning they change how light passes through them in a way that helps identify them. Finding these crystals in the joint fluid is considered the gold standard for diagnosing gout because it provides direct evidence of crystal deposits causing the inflammation. This helps distinguish gout from other types of arthritis, like pseudogout, which involves different crystals. In addition to crystal detection, the analysis also checks the fluid for signs of inflammation. Usually, the fluid in gout contains a high number of white blood cells, often between 2,000 and 50,000 cells per cubic millimeter, reflecting the body's immune response to the crystals. The lab also tests the fluid for bacteria using gram stain and culture to rule out septic arthritis, which can cause similar symptoms but requires different treatment. Sometimes, when crystal analysis isn't available, doctors measure the uric acid levels in the joint fluid and compare them to blood uric acid levels. A higher uric acid concentration in the joint can support the diagnosis, but it's less definitive because uric acid levels can be normal during an attack. That's why seeing the actual crystals is so important. This method is more accurate than blood tests alone because serum uric acid levels can fluctuate and don't always reflect the presence of crystals. Joint fluid analysis provides direct, concrete evidence of gout, helping doctors make confident diagnoses. It's especially useful when the clinical picture isn't clear, other joint diseases are possible, or infection needs to be ruled out. By confirming the presence of monosodium urate crystals, this test guides appropriate treatment and helps prevent future attacks. Always remember, if you're experiencing joint pain, consult a healthcare professional for proper testing and diagnosis tailored to your individual needs.